I'm the Chief of Neonatology and currently serving as the co-medical director, outgoing medical director for the Neonatal Intensive Care Unit here at Arkansas Children's. As a medical director, I work very closely with the nursing staff, the nursing director, really to help develop best practices and improve quality of care. I started here in 2003 as a fellow in neonatology and then loved it so much I stayed on as a faculty member in 2006. So neonatologists, I like to think of are kind of the primary care specialist for newborns in the sense that you're their first doctor, but yet you also provide high-level intensive care. So many of our patients are newborns that have problems with breathing. They may have something different about the way they're formed or made. They may have an issue, for example, with the way their heart's formed. And we're there to provide the intensive care that's needed for patients that require intensive care after they're born. I can speak to it as not only a physician, but also a parent. I have 4 children, and 3 of them actually started out in the neonatal intensive care unit. It's one of the scariest times of your life. Everyone expects to have a very healthy newborn, and when their newborn's not healthy, it's very scary. So we're not only there to provide that intensive care for the baby, but I like to say intensive care for the family as well. So we do things that help babies breathe more easily. We help their heart beat stronger. We make sure that they have great nutrition. Those are all kind of key aspects to what we provide, along with a lot of good family support while they're there in the intensive care unit as well. I think it validates kind of that holistic approach to taking care of the family. I was very fortunate to have great role models in that respect. The former section chief and other mentors that I've had who really believe that mental model of holistic care and care for the whole family is so important. And I think that's kind of where hopefully that came from for that family. They saw that. There are different levels of care for neonatal intensive care units that are outlined from level 1 to level 4. Arkansas, as you mentioned, only has 1 level 4 NICU, and that's here at Arkansas Children's Hospital. The easiest way to think about it is we provide the most comprehensive services for newborns needing intensive care. And that means that we have all the right doctors and nurses and nurse practitioners. It means that we work very closely with surgical colleagues to ensure that there's every surgical service available. Importantly, it also means we can provide extracorporeal membrane oxygenation, or ECMO, which is heart-lung bypass for patients. It really means a comprehensive, full-service neonatal intensive care is what level 4 means. It's a mobile intensive care unit, so they can go out on helicopters or they can go out in an ambulance. And what parents and physicians and others in the community should know is we're bringing our level 4 NICU care to your hospital to pick up your baby. The teams that go out are just incredible. They spend lots of time training and simulating so they can be prepared for every scenario they need to be when they go pick up a very sick newborn. It's just an incredible service that we have here at Arkansas Children's Hospital. I literally can just pick up the phone, talk to a referring provider, and I know that that baby is going to get the best care possible when that team gets to them. For me, it recognizes that it's a team effort. In the NICU and other intensive care units, it doesn't work without a strong team at all levels. It means that you have a strong nursing staff, strong therapists, strong respiratory therapists, your providers are highly engaged, and you're constantly looking for opportunities for improvement. That's what this recognition really means. It means that you're really functioning at the highest level you possibly can. So our neonatal intensive care unit is really set up when you walk through the door to recognize that you are the parents and that you're part of the healthcare team. So we get you oriented to not only where your baby's going to be, but also the providers that are going to be taking care of your baby. We want you all to also to understand what equipment, what supplies, what the ventilator's doing, so that you can kind of look past those things and really focus on your child. So getting an awareness of the environment is very important. Also, knowing who your providers are is very important because you are wanting to build confidence in your team, and so we want to make sure that as a parent you know exactly who's going to be caring for your baby on each shift. One thing that's also I think really important is daily communication. So we create an expectation that we're going to reach out to you in some way every single day so that you know what's going on We know that parents can't be at the bedside 24 hours a day. Life has to go on. But providing that connection to the family through a phone call, through a HIPAA-compliant text, or really amazingly, the Angel Eye camera system where they can watch their baby 24/7 if they'd like, or ways that we stay connected. So the Angel Eye camera system, there's a camera at every single bedside in the neonatal intensive care unit at this point. And it allows for families to log in and actually view their baby. It's very important, especially for moms who may be providing their milk and are pumping. They can use that to kind of enhance their milk supply by being able to see their baby. Provides a level of connection that just isn't there with a phone call. It's really, I think, transformed the way that families feel connected. And what's amazing is families can share that login, and we've literally had families from around the world that would never have been able to be engaged or participate or see their family member be able to do that through the Angel Eye system. We know that one of the factors that contributes to infant mortality is unsafe sleep situations. It's one of the easy things that we can do. We can model in the NICU. We can teach parents what it means to have a baby sleeping safely. And that's really where kind of our project in the NICU started. Was we wanted to do more than just take care of those babies in the NICU, but how could we have an impact that goes to the community level as well? So one, don't have your baby sleep in the bed with you. That's number one. Number two, always on the back and nothing in the bed. That means nothing in the bed other than the baby and a sleep sack. Those are the kind of three most important aspects that we highlight when we talk about safe sleep. I think it's really important to understand that our understanding of science and healthcare is dynamic and it changes. We have new techniques to investigate. We have new questions that we can ask and new ways to measure it. And so over time, there can be changes in recommendations, and it sometimes can be hard to keep track of that if you're a parent, especially. So it's very important to reach out to your healthcare provider to understand kind of what is the latest and greatest and best recommendation. It's hard because we all know grandparents are always right when it comes to their grandkids. At least that's, they get away with a lot in our family. However, I think especially if they're in the neonatal intensive care unit, hopefully the modeling that we're doing helps influence not only the mother and the father, but the other caregivers as well. So, if a parent needs that extra support and backup, reach out to your primary care provider. If you're in the neonatal intensive care unit, come to us and let us have an honest conversation with the family and be transparent and acknowledge that the recommendations have changed. But we are very clear about what is safe today for babies. Think about the recommendations of always sleeping on the back, nothing in the bed. Having bumpers in the bed, having stuffed animals in the bed. Babies are not real mobile in the very beginning, but they can scoot around and they can get entangled in some of those items that are in the bed. They can get buried in some of those items and have difficulty breathing as a result of it. We know that babies who are not sleeping in a safe sleep situation are at increased risk of what used to be called crib death. And that's really the concern that we have. We know that there are the things that we can do to help promote safe sleep and create the best environment for that baby to be healthy. I think that I have many different roles, and my job entails a lot of variety, but the reason I became a physician was to take care of patients and families. What I value the most is helping a family through that journey of the scariest time of their life. It's not, like I said, just intensive care for the baby, but it's intensive care for the family. And having been a parent with children in the NICU, I find that part of helping a family through that uncertainty to be the most rewarding part of my job.